Hi, this is Dr. Doreste with the cranial release technique. We're back with another video, back with my friend from Woodstock, Georgia, Dr. John D'Ambrosio. John, good morning.
Good morning. Always a pleasure to be here.
Always a pleasure. Thank God. We're above ground. It's a good day, right, John?
It's a very good day. I'm glad we're doing this. We had, at least I had people reach out to me with some follow-up things that they wanted to talk about. I know we planned to do it a part 2, but it just fed right into it. So it's beautiful.
Okay, perfect, great. Before we get started, Soledad, you want to just come in and say hi to everybody? Because everybody hasn't seen Soledad in many years, so.
Oh, look at her. More beautiful than ever.
Hello, John. Hello,
Hi, Soledad. Soledad is also a black belt in CRT.
Yes.
Absolutely. She's my practitioner, so she better be a black belt. Otherwise, she'll fail the test.
Yeah.
Thank you. See you later. Okay.
Enjoy.
Thank you.
All right, John. So take us wherever you want to go here.
All right. One of the big questions I get from a lot of people, and I have my own answer for this, but I'd love to hear your take on it, is I love my technique, but CRT sounds amazing. Do I have to stop doing my technique if I have CRT, or how do I make it work?
Right. Well, that's a good question. And of course, the answer is you're out there, you're doing whatever technique you're doing. That's fabulous. Should you decide to join cranial release, learn how to do it correctly, you'll do both initially, and you'll see how you want to do it. Now, when I first started this, and I was really refining it, I was doing my traditional chiropractic adjustment, osseous type adjusting, and then I would do the cranial release. And as my confidence and skill level improved with cranial release, one day, just out of the blue, I said, you know what, John, come on over here. Let's do some checks. I found some positive tests based on cranial release analysis. And I went straight to the cranial release. I went back and I saw that the test was improved. And then I went back to the spine and I saw that the things that I normally would adjust were basically all gone, mostly gone. And maybe I did one little thing or two little adjustments, more than what I normally would do. And then that started a pattern. And then let's say the next time I saw that patient, they'd come in, check them, do the CRT, go back, recheck, see improvement, and say, that's it for today. And that's how I did it. So I sort of eased into it. I didn't come in and say, okay, starting today, everybody, this is all you get. That's it. No. If they're used to you doing something for the last few months, few years, whatever, that's what they're expecting on the next visit. So I think you have to just be smart about it. But also, I think a mistake that I do see with some practitioners is that people will do their technique, go right into cranial release, and not even explain what they're doing and why they're doing it. And then the patient might come back and say, wow, I don't know what you did last time, but let's do that again. Now, they don't even know what you did. They have no reason why you did what you did. So I would always do your best to sort of separate it, whatever your profession is. Chiropractic, physical therapy, occupational therapy, acupuncture, dentistry, massage, whatever it is you do. What I used to do is I would say, hey, John, let's schedule a visit where you can give me another 15, 20 minutes because I want to explain this thing. This is for the old patients that are used to just a traditional adjustment that never understood cranial release. The new people that came in, I went straight into cranial release for me. Now, if you love doing your reflexology and you're going to do that on everyone and add cranial release, great. If you love doing your needles and you're going to add cranial release, great. However you want to handle it, you can't go wrong. But I would try to separate it. And whether you're going to separate it with a fee, some people will do, or some people, I know some therapists will say, well, it's an hour session and it's $75. But if I'm going to do cranial release, it's a 30-minute session with cranial release and it's $75. So they'll try to give it value within the framework of the visit, and you have to do what's right for you. Some people just add it in as part of the visit. Fine, if that's what you want to do. Some people will separate it. Some people will do it as a standalone. whatever you want, but I would say make sure you explain it, educate the people on it so they know what it's about. So they'll see, number one, you're different from everyone else down the block. And maybe this is something that's going to help my friends and family more than just traditional chiropractic, traditional massage, traditional acupuncture. So it's a long-winded way to say, do whatever you want, but just do the CRT, I guess.
Yeah, and that makes a lot of sense. And especially from us teaching together and going to different seminars where there was a whole bunch of other techniques being taught at booths, being promoted, and people having those things done, and then coming to us. CRT has a specific set of tests that are actually very unique that other techniques do not check for. So it goes beyond leg length tests. And we would then do our tests on these people who have been adjusted by the other techniques, and they would fail these tests. We would do the CRT and they would clear. So I think just the fact that CRT comes with its own set of tests kind of helps to validate, look, although you're balanced with this technique, we're still finding that there's areas of the body that are not working optimally. So let's clear that out. And it also depends, I think, on what you're practicing. If you're doing massage, I would absolutely recommend doing a CRT first, because it makes the massage so much better, because all the muscles in the body loosen, the fascia loosens up and opens up, so you can really get in there and get a great massage, versus giving the massage to these muscles that don't want to give and then doing the cranial release after that. It seems like it's kind of backwards to me. What are your thoughts on that for massage therapists?
I would say any type of body work, or anyone that's doing soft tissue, even whether chiropractors, massage, PTs, whether it's ART, myofascial release, whatever you're doing, in that case, I would certainly say do the cranial release first. When you balance the cranium, you balance the spine from the cranial release technique. You release the dural tension, you release the fascial tension, the muscles become more balanced, become more relaxed. Then you go in and do your technique. That certainly makes more sense to me, yes. Then you probably could shorten your visit, keep the price the same if that's what you want to do, shorten the visit, be much more effective, much more efficient, and much easier, because at the end of the day, John, you and I know 20, 30 years, 40 years of this body work, whatever type of body work you do, it's certainly physical manual labor. And how many chiropractors can't practice anymore because of wrist trouble, shoulder trouble, neck trouble, back trouble, from the actual act of the adjustment? Whereas in theory, the cranial release is done very gently. It's easy on the practitioner. We're always in balance when we do it. And it just makes life much easier for everybody, both for us to extend our career. You can see more patients if that's what you want in a day, and better results for the patient. Absolutely.
Definitely. And another question I get tied into that is, and we kind of discussed it last time, but I think maybe if you go a little deeper into it, how can something so simple where you're affecting the skull have global effects on the whole body? Like we said, releasing the fascia, the muscles, aligning the spine. How is this possible?
Right. Well, it's funny you say that. I just did a video a day or two ago on this on YouTube. So after you watch this, you can go back and watch the other version. But again, we start off with the concept that, number one, the central nervous system controls all functions in the body. So we know that. That's the brain and the spinal cord. In chiropractic, most of the time we work from the occiput or C1 down, the first bone in the neck, which virtually is 20% of the nervous system. So that's what led me into cranial work. How do I get to the 80%? And that then opened up a whole can of worms. How do you address this issue? And we've discussed before about different techniques and thumbs in the mouth and balloons in the nose and things like that. And there's probably many different, look, there's all different ways to get to Rome. I just think this is the simplest, easiest way. So we have the 22 bones and they're moving, the primary respiratory mechanism. And covering the brain, we have the dura mater, the toughest tissue in the body, stronger than bone, covers the brain, covers the spinal cord, covers every pair of nerves that exit through the spinal cord, covers the autonomic nervous system, covers everything, becomes the fascia, probably every tissue in the body leads back into the dura and back up to the brain. if you can sort of reset this cranium, in theory, you can address everything from the athlete with a foot issue, an ankle issue, to an extremity issue, to a sympathetic issue, parasympathetic issue, to a whatever, fill in the blank, to mental emotional issue. So the simple answer is, by addressing the cranium and therefore the brain, you're at the deepest levels of who we are as human beings. And really, at the end of the day, all you and I want is to balance that patient's body, to let them leave better than they came in. I brought my car in for service yesterday. Tune up, oil change, this, that. I drove home. Now, I didn't notice a difference, but they tell me by the computer everything's going to run better. Okay, and I believe that, and that's going to extend the life of the engine. And although I don't like that analogy, some people understand that, this concept of preventative maintenance. You know, most of us get up, swig down a cup of coffee, run to work, run here, do this, do that, put whatever in our mouth we want. We don't really think about, we just try to get through the day. So making time to come to see someone like you, someone like me, someone that does cranial release, and get this tune-up, so to speak, this preventative maintenance to allow the body to function better. I don't know, you know, I've been working on my mother as a chiropractor since chiropractic school and cranial release for the last 20 years. She's 87. All of her friends they don't function like my mother. None of them can walk like her. None of them have digestion like her. None of them sleep like her. None of them have energy like her. None of them are sharp like her. All you see them people just getting duller and duller and duller. Now, of course, there's exceptions to every rule. I think some part of that has something to do with chiropractic over 20 years and now cranial release over 20 years. And she knows it. She's in tune with her body. Can you work on me? Something's not right. Not even necessarily physical issues, physical pain. It's an inner knowing, a sensing of your body and how it's functioning, and something's not right. I don't know what it is. I ate good, I slept good, but something's not right. I do the cranial release. I needed that. Thank you. And it only takes a minute. So, I mean, it's such a wonderful gift to give other people. I see a time, and hopefully it's in our lifetimes, I see a time when everybody knows what this thing cranial release is all about, and they have access to go and jump on a table and experience it. That's the way I see it.
And that's so important. And the fact that it is such a global technique, when you were talking about extremities, it reminded me of when I was down in Florida, helping to teach this. I had a room full of about 80 other chiropractors in there. And at the end, I was doing some demos on people. And one of the tests we would do is they'd be lying supine and you turn their legs in. So this one person, his one leg went in like this, the other one stopped there. And he's like, oh, I really injured this badly years and years ago skiing. So I said, all right, let's see if that's really what it is. So I did the cranial, I come back around and everybody's watching. Both legs just go in beautifully. I didn't touch his leg, I didn't touch his hip. Everybody, the room just, I was amazed at how excited the room got. People were high-fiving me. And it was just because this was something this guy had 15 years. I had a skiing injury. My hip is out. Yeah.
Chiropractor.
Yep.
And I'm sure he's getting his back adjusted, his hip adjusted, his legs adjusted, everything. That's the other point, is you can't, in my experience, you can't get to the cranium through the spine.
I agree.
You can't get to this mechanism by working on the atlas or the axis or the occiput. You have to direct the energy and the focus and the technique towards the cranium, and not just a segmental, you have a TMJ issue, or you have a frontal problem, or you have an occipital problem. It's a global issue that needs to be addressed with a global technique, which cranial release technique is. And that's why when you did that, just like we always say, like the dominoes all in a row, you could knock the 100 dominoes down one at a time, or you could just hit the right one and there they all go. That's right. Exactly what happens with CRT. That's happens all the time. How many times have I checked the patient? Oh, doc, that hip doesn't go in because I have a hip replacement. Okay, and they do have a hip. Okay, I had a
Right.
surgical issue. Okay, you do the cranial release, and boom, they both come in. It's like obviously I didn't touch it. I didn't play with his hip replacement.
Right.
There was a
Yeah.
muscular contraction in there secondary to a cranial issue. And when you clear the cranial issue, the body, and that's just 1 minute after the technique is done.
Yeah.
Now, throughout the day, that's going to improve. And throughout the night, while they sleep, they're probably going to sleep better. And tomorrow, it's even going to function better. So, even the people that are scheduled for these operations, I need a new hip, I need a new knee, I need a new this, I need a new that. I don't know about you. The last resort is someone going in and replacing one of my joints. I mean, I'll try everything.
Yeah.
And I'll try this thing called cranial release. I'll try acupuncture. I'll try anything before you got to take the hammer and the chisel to me. But
Right.
at the end, if that's what we have to do, thank God technology is better now than it's ever been. But why not try to optimize function now, especially now when you're younger, assuming you're watching this now and you have no issues. This is the time to do it. Don't wait until the wheels are falling off.
Right. Definitely.
But again, everyone's in a different place and everybody's got different priorities, and that's the patient's decision. I can only educate you. And if this is what you want, here's how we'll work something out. We'll get you the care that you need. But if you don't want it and you want to go the other route, well, I'm here to help you whenever you're ready for me,
Definitely.
That's always the way I did things. So,
and it's amazing to me with all of that it not only will affect, like we said, the extremities, but it does align the entire spine. And you think, well, how does it do that? And I think one of the ways, and we've kind of discussed this in the past years ago, but I think because of the primary respiratory mechanism being in the skull and also the sacrum, if you get those two working, it takes attention out of the entire system, and then the body can correct itself, which in some cases, like we had said, you may do a cranial release before your normal visit and check, and you may find everything lined up and nothing to adjust at that point. And I think that's one of the main reasons.
Right. I trained many years ago. I had a student that came in. He was an older chiropractor. He was an SOT practitioner who knew Dr. DeJarnette, who was the founder of the sacro-occipital technique. Mm-hmm. Some people out there may know it's called SOT, sacro-occipital technique. And he claimed to have been, Dr. DeJarnette claimed to have been a student of William Sutherland, who was the founder of the primary respiratory mechanism.
Yes.
And in every technique, you have your general students, and then you have your inner circle, let's call it. And this doctor that came to my seminar was in the inner circle with DeJarnette, the founder of SOT. And he said, behind closed doors, he said, the truth is, guys, it's all in the cranium. I can't say that because the chiropractors aren't ready to hear it. But I hope one day they will understand it's all in the cranium. The spine is compensatory to the cranium. That's what his theory was. So in SOT, everything is done to balance the pelvis, to affect the cranium, but the upper level work is to affect the cranium directly, craniosacral, and really the rest of the spine. Leave it alone, let it do what it needs to do, take care of the top and the bottom, and then he said to his inner circle, just take care of the top. So there you go.
And that's pretty much like when you're tuning a guitar. I mean, you have the thing up here, you're tuning it from here.
That's
it
true.
Doesn't matter what you do with the strings or at the bottom, it's all up there.
That's a very good analogy. I never thought of that one, John. And I like that you did that up there too. I think you should put a little a little wrench up there and you can
just twist my ear.
That's it. That'll work. Unfortunately, John, I think we're almost out of time again.
Okay, do you have a quick second? I just wanted to, I know one point, during one of the trainings there was an acupuncturist there, and they did the test with the tongue before and after, and the change that they saw. Do you have enough time to touch on that quickly? I remember you had said, I mean, to just recap, he had done a check on somebody, right? Because at the demos, we have everybody do whatever checks they want to do, and they're all on the board. The acupuncturist wrote down all the things he found. You did the cranial release. He rechecked the pulses, the tongue, and what he saw was he said this would have taken me months to get these results, and you did it in a minute.
I do remember that. I do remember that, and you're right. And he did say that this would take months to clear. And again, I don't know much about Eastern medicine, but he was blown away by that when he saw that, about what can be done with this cranial release. And this is one visit, 1 minute later, again.
Right.
Never mind the person that's under regular care. And just on that note, John, again, cranialrelease.com. This is going to be on the YouTube channel. Cranialrelease.com is the website. There's a button there called online training for those of you that want to learn more about how do you learn this. And there's another button called events, and you can click on that for our live event, which is going to be December 2nd in Fort Lauderdale. And that's going to be a very small, intimate setting. I'm hoping John is going to be there. I'm hoping some of the other instructors are going to be there. I will be there. It's going to be 15 people. And let me just get rid of this notification. It's telling me we're out of time in the next minute. So we hope to see everyone there. But again, step one, go to the online training and learn that. Step two, come to the training, the live training. And if you're a past CRT practitioner, if you've done the live event, like what John and I are talking about, you've done the live 4-day event, you're eligible to just come right to December 2nd to the mastery review class. So,
And it should be great. Well, we all need a brush up.
absolutely, myself included. I'm going to watch all you guys. You're going to critique me too. So, John,
Great.
thank you as always for coming and doing this interview with me. I appreciate it.
My pleasure.
Everyone
Thank
enjoy
you.
the weekend. It's just for the record, it's August 11 at 11:30 a.m. in New York City. Be
All
well,
right.
everyone. Enjoy the rest of the summer. And any last words, John?
No, this was a great interview. Thanks again.
Thank you, John. I appreciate it. Talk to everybody soon. Have a good day.